Good morning, good afternoon, and good evening to all. Welcome to the session on promoting fair recruitment for migrant care workers, which is one of the sectoral sessions of the Global Forum for Responsible Recruitment. Let me introduce myself. I am Manuela Tomei. I'm the Director of the Conditions of Work and Equality Department, and I have the privilege of moderating this session. Our objective is to explore the recruitment issues that are specific to the circumstances of migrant care workers. Care work is often referred to as work that makes all other work possible. And as per the ILO's definition, paid care work comprises a broad range of occupations in the education, health, and social work sectors. However, for the purpose of this session, we will zoom in on a smaller range of workers, namely nurses, personal care workers, and domestic workers, as they face significant challenges when it comes to enjoying decent work. Typically, care workers have a women face. Often they are migrants or of migrant background, and they may work for low and insecure pay, poor working conditions, with no or limited social protection. This is a reflection of the historic undervaluation of paid care work, which is seen very much as an extension of work that women have historically carried out and continue to perform without pay for their own families. The situation of care workers has come into the spotlight recently with the COVID-19 pandemic. While they have been on the front line, we have reports of some workers lacking protective equipment, thereby putting their lives at stake while trying to save other people's lives. They have been working extremely long working hours and exposed also to increased violence and harassment by neighbors who fear contagion or are by exasperated family members of COVID-19 patients. And they have been excluded in many cases from income loss support measures. This takes place within an ongoing crisis which predates the current pandemic. I'm referring to the care crisis, which affects countries all over the world. By 2030, the number of people in need of care is expected to reach 2.3 billion, driven by an additional 200 million older persons and children. If not addressed properly, current deficits in the supply and the quality of paid care work will undermine the resilience and the sustainability of future societies and economies. These deficits would also widen further gender inequalities at work, given the large numbers of women who are working in these sectors. The challenges are huge, but we are here today to indeed learn about innovative and promising practices and solutions. Let me give you a few housekeeping information before moving to introducing the four panelists of today's session. Please bear in mind that interpretation is available in English and Spanish. You need just to select the language button with the globe icon on the right of the screen and mute the video player. If you wish to ask a question to a panelist, use the questions tab on the right of the screen. You will also be able to like or upvote other attendees' questions. And we will start the sessions with a round of introductions. Then I will ask a couple of questions to each panelist before opening up the floor to questions from the audience. It is my pleasure now to introduce our four distinguished panelists. Mr. Stefan Hoyke. Welcome, Stefan. He is the Managing Director and Deputy Head of International Services at Bundesagentur für Arbeit, sorry for my pronunciation, the BA that in English means Germany's Federal Employment Agency. This agency facilitates entry into the labor market for migrant workers, including nurses and care workers from a number of countries, including Mexico, the Philippines, Tunisia, and Eastern Europe. Welcome also to Mayank Patel. He is the Middle East country manager for the Adeco group, which like to portray themselves as a talent solution and advisory company. Adeco Middle East provides staffing and recruitment services for a large number of clients, including medical and care workers, the majority of whom are migrant workers. And at the international level, Adeco has a number of mechanisms to ensure fair recruitment, including a global standards and compliance mechanism against payment of recruitment fees by workers. We also count on the participation of Herbert Beck. Good morning to you and welcome. He's a trade union and senior advisor at Public Services International, which is a global union federation which brings together 700 trade unions representing over 30 million workers in the health and social service sectors. Since 2013, Mr. Beck has been a member of the Joint Monitoring Committee for the bilateral intergovernmental labor agreement between the Philippines and Germany concerning the placement of Filipino health professionals. And last but not least, Fanny Galaes. She's a representative of the Comisiones Obreras, a trade union of Catalonia in Spain, where she is the head of Domestic and Care Workers Division. Ms. Galeas is also the secretary of Mujeres Unidas Entre Tierras, Women United Across Lands, which is a migrant-led, women-led association that focuses mainly on providing support to migrant domestic and care workers. So let's start with the first round of questions, and I would like to address my first questions to Stefan Hoike. Stefan, Germany has a very comprehensive program for recruitment of migrant care workers, including nurses. Could you tell us a little bit more and explain the role of the Germany's Federal Employment Agency in this program? And also, what is the relationship between these federal employment agencies and private recruitment agencies? The floor is yours, Stefan.
Thank you. I would like to answer the second question first because it leads to the first question. So to understand our relationship with private recruitment agencies, you must understand that primarily our relationship is more one which is characterized by competition instead of regulation. The Federal Employment Agency still has its own recruitment agents on the ground in the countries of origin and is one of only few remaining public employment services still providing that service. As regard to the care industry, about 50% of our own recruitments are in the care industry compared with our overall recruitment efforts. However, only 5% of the market share in this area in relation to work permits overall are shared by us. The rest, 95%, are private agencies or direct recruitment by employers. So you can see competition has been tough and is getting tougher. So traditionally, and this is developed over the last 25 years, there is no remaining role for our own agency in oversight and regulation, with a few not much relevant exceptions. This has changed, however, significantly through the Skilled Immigration Act, which came into force in 1st of March in 2020. Which is new is that we have introduced, or legislation has introduced, a formalized system of recruitment agreements with countries of origin, which allows for easier visa and professional recognition processes and is basically a modernized version of the Triple Win program, of which you will hear more from Herbert Beck. So in this new system, the BA, the Federal Employment Service, is responsible for final approval of all placement offers by private recruiters in the context of these recruitment agreements, where these are applicable, which is one of the basic innovations in the new system. This makes scrutiny, especially concerning conduct of agencies and working conditions, possible. However, the concrete process of this approval system is still a work in progress. Another innovative idea to combine the expansion of the market share and the upscaling of the recruitment efforts overall is to combine these expansion with more oversight. To facilitate this, we are planning to upscale our recruitment efforts on the ground by contracting out to private agencies in the countries of origin. As part of the system, compliance to fair recruitment standards, and if it's part of their share of the whole value chain, will be a contractual obligation to the private employment agencies contracted out by us. That's for now.
Okay, that's very interesting. Also, how indeed you have been the role of the Federal Employment Agency has evolved also in the face of growing competition, and how you have been moving into developing more sophisticated and effective devices to improve regulation and oversight. Thank you for those answers. Let's move to Mr. Mayank Patel. We have heard about public employment services perspectives on the recruitment of care workers, and we would like now to hear the experience of Adeco, who is a very important private actors in the recruitment business. And I would like to ask you, Mr. Patel, I know that during the COVID-19 pandemic, there has been a very significant increase in the United Arab Emirates for home care workers. So we would like to know what have been the additional provisions that you have taken with a view to ensuring fair recruitment for migrant health care workers, and also how have you dealt with the challenges associated with the very different and exceptional circumstances in which indeed recruitment is occurring these days? Over to you, Mr. Patel.
Sure. Thank you so much. And first of all, my privilege to be on a part of this discussion. So as you rightly mentioned, that Adeco in Middle East is one of the leading player into the recruitment business. But to answer your question, I'll just like to give you a little background that Middle East, or let's say United Arab Emirates as a location, has almost 90% expat population. So it's always a challenge in most of the industry for us to get the right talent and follow all the protocols. And Adeco being a Swiss multinational, we follow all the international norms of fair recruitment, as well as we are the part of World Economic Forum where we follow all the norms. And COVID, I think, was an unprecedented challenge in front of us because, yes, there was a lot of need of home care workers, people who are doing testing, people who are doing the lab technicians, the ICU intensive care unit people and all. And because most of the time, the talent which we export is from outside the country and countries like India, Philippines, or a lot of Asian organizations, countries as well as Eastern Europe. And due to pandemic, there were no visa approvals. So it was a further challenge to manage the situation which was exploding, and also to provide the right talent in the organization or to the DHA, which is the Dubai Health Authority as a government entity. But I think what went right and we could overcome the challenge was that there was a lot of support from the government. So typically there are certain norms which we need to follow in terms of certification from Dubai Health Authority, the DHCC, which is the Dubai Healthcare Authority, before a healthcare worker or a care worker starts his work into the practice. But during COVID, because there were restriction on visa, there were some exceptions given in terms of transferring of the work permit or giving an what you call an NOC from a current employer for a temporary period to support the cause. And from an organization point, Adeco takes care of the employees, whether they're care workers or non-care workers, in a defined protocol. And during COVID, we were able to manage with the strict support from the government in terms of the protocols. So example, let's say if we have people who are doing the COVID testing or collecting the samples, there were transportation being arranged by the organization along with the support from Adeco as well as the government. Twice a day, they have to change the PPE kits. Every test, they have to change the gloves. Every care worker was going through the PCR test twice a week. So their safety has been taken care. And I think many of them are also part of the COVID vaccine trial, which helped. And on the priority, when the vaccine was rolled out, I think they were given vaccine. But during pandemic, we saw that there were a lot of exceptions and support given to this particular talent in terms of their accommodation, travel, and as well as the safety norms, which we had to follow from this. And also, what we partner with a lot of organizations to ensure that there are basic hygiene, the basic standards being maintained. Whenever we recruit from overseas, we have a very strict protocol that we don't use the local agency because Adeco is present in almost 65 odd countries. And there is a clear declaration of no financial transaction to get a job or to apply for a visa or something. And we also do a video interviews with all the candidates to ask, was that anything process been broken during the entire chain of recruitment? And once they are back to the host country, we also ensure that there are minimum standard of accommodation and hygiene being followed by our clients, and there are contractual arrangements which we get into. And if some customers do not agree or align to those expectations what Adeco has, then I think we do not partner with those organizations. But yes, there's a lot of work which we do in terms of ensuring the safety and managing the talent pool at this point of time.
Well, I think that you actually highlighted a very important point, and which is that in particular circumstances in which indeed the challenges are greater because on one hand there was no longer approval of visas and also the difficulties associated with identifying the right set of skills and people with the skills required. You managed to somehow overcome some of these challenges thanks also to the support from the government that indeed put in place a number of support measures with a view to allowing that this increased demand for care services was indeed matched. It's quite interesting what you said also about how to ensuring that the care workers themselves don't get infected by the virus. Can you tell us a little bit more about that particular point?
So yeah, I mean, see, as I told you that they are the most. We are all thankful that we have such talent who are risking their lives to support a larger community. So what we did is that their safety was of the prime importance. So right from arranging the transportation, because public transport and most of them don't have their own cars to reach to the hospital. So there were strict norms of maximum 3 people into a car or in a van. So we used to ensure the transportation is as the safety measures. Second, once they reach the facility or the COVID testing center, they go through a PCR test twice a week, and the results are arranged within 4 to 5 hours. Then the PPE kits are changed. So usually they have 10 to 12 hour shift with an overtime paid after 8 hours. And they change the PPE kits twice a day. And for every new patient they touch or they do the COVID testing or take the swab, they use new gloves and sanitize themselves. And if anybody is not feeling well, immediately I think there is a precaution being taken to go through the medical screening. and help support this talent in the larger cause of the community at this point of time.
Thank you very much. Let's move to Herbert Beck. As I said earlier on, trade unions are very much involved in the monitoring of a bilateral program on recruitment of migrant workers that move from the Philippines to Germany, which is also known as the Triple Win program. The program provides for the recognition and participation of trade unions, including in the implementation and the monitoring of the bilateral agreement and through representation on the joint committee of the bilateral agreement. We would be very interesting, Mr. Beck, to hear a bit more about which have been which are the key recruitment aspects of the agreement and what have been the most challenging provisions and elements to implement. Over to you.
Thanks for the invitation and the opportunity to speak. First of all, the elements of the I hear myself. So, okay. Well, the key elements are it's a holistic and rights-based approach, this bilateral agreement. It's complying with human and labor rights norms, with ILO standards and norms, and fair recruitment initiative. And last but not least, the WHO Code of Practice. It's containing occupational health and safety, non-discrimination, social protection and security, access to justice and the right to join trade unions, and last but not least, social dialogue. The Triple Win project is based on this bilateral agreement, and it provides transparent information, language course, pre-departure orientation training in the country of origin. In Germany, the migrant worker will receive same salary, benefits, working conditions, and social protection comparable to a national worker. So we don't make a difference between a migrant worker and a worker. All are workers, all are treated equally. So other elements of this Triple Win process is the migrant worker decides on the duration of the employment. It's the possibility of bringing one's family, portability of social insurance contributions, and we have a integration concept. So to make it round, the challenges, it was more a challenge to explain Triple Win in a few words. But indeed, there was no real challenge regarding the implementation. Maybe some minor problems in small elder care homes or in hospitals, small hospitals. However, Verdi was and is able to intervene. One challenge is in organizing Filipino nurses into unions before they migrate and when they are in Germany. So in the Philippines, our sister union, PS Link, provides pre-employment orientation seminar. And in Germany, my union, Verdi, provides legal representation and support to the migrant worker. However, when its problems arise, that they seek help from the Works Council and where Verdi is able to intervene and to provide legal representation and support. Our Works Council is monitoring the compliance with collective and company agreements and legal requirements. So the Works Council is providing individual information and advice, supporting and representing the migrant worker to the employer.
Thank you very much. It's actually very, very interesting to see how within this triple win program, besides the social dialogue among the different actors concerned, there is also cooperation within it across borders between trade unions at both ends of the spectrum. And it's quite indeed interesting the range of different issues that you are monitoring, from OSH to non-discrimination, access to justice, and the possibility of joining a trade union. I would just like to ask you, one last question, but just 1 minute. In your view, how replicable this experience is in other migration corridors?
Okay, well, replication is possible in other sectors. However, political will is needed. The basic principles can be applied in any other migration corridor. So social dialogue is free of charge. Workers' rights included migrant workers. Human and labor rights should apply in every country. So all workers deserve decent work, non-discrimination, access to justice, to join a union, and deserve a fair and transparent recruitment without paying any recruitment fee.
Thank you for that. So indeed, what we need is political will and support, belief and support to social dialogue. Let me now move to Fanny Galeas. She has, as I said, she is the working in for the Comisiones Obreras, a trade union in Spain, and she has been during the pandemic playing quite a very active role in terms of advocating for the protection of care workers, many of whom are migrant workers, migrant women workers. So we would like to hear from you what have been some of the experiences of migrant care workers in Spain during the pandemic. Fanny.
Vale, hola, pues muchas gracias, ¿no? por la invitación que nos han hecho a este foro. Una de las cuestiones que hemos vivido como sindicato, como Comisiones Obreras de Cataluña, es que nos hemos encontrado con que el sector del trabajo del hogar y los cuidados ha sufrido o está sufriendo actualmente una fractura, ¿no? En todo el tema de defender los derechos laborales de las trabajadoras del hogar. Una de las principales y no tan excepcional que nos ha tocado vivir como sindicato sería, bueno, desde muerte de una trabajadora del hogar a causa de que su empleador no le ha dejado ir al médico. Esa sería una de las cosas más fuertes, ¿no? y extremas que nos ha tocado vivir y que hemos estado, ¿no? al lado de cada una de ellas. Y bueno, desde Comisiones Obreras, ¿no? estamos trabajando, ¿no? en la reivindicación del convenio 189 que vendría, ¿no? a mejorar lo que es el sector del cuidado. Respondiendo y entrando en materia lo que lo que me has preguntado, queremos poner de manifiesto de que los derechos laborales y la desigualdad que están padeciendo la mayoría de mujeres que son migrantes, ¿no?, de terceros países, lo hemos visto en época de pandemia, ha sido muy dura, muy dura. Nos ha tocado trabajar con la organización del sector, que ya veníamos desde hace mucho tiempo atrás trabajando, pero ahora hemos dado un paso súper grande, ¿no?, en crear un ámbito específico para estas trabajadoras, para seguir luchando, ¿no?, contra esta discriminación laboral que están padeciendo actualmente mis compañeras.
Entonces, sorry, I will revert to English. So, based on your experience in Spain, could you tell us, including the audience, what in your opinion would be the measures that should be taken with a view to ensuring that indeed the rights of care migrant care workers are fully respected?
Vale, una de las principales apuestas que estamos haciendo como sindicato, como comisiones obreras de Cataluña, sería la ratificación del convenio 189. Ya sabemos que con esta ratificación, ¿no?, las trabajadoras pues tendrían cómo defender pues lo que es todos sus derechos, pero delante de la ratificación del convenio 189 sabemos que hay un trabajo arduo, ¿no? No solamente es la ratificación del convenio, sino que tenemos que trabajar, ¿no?, para que el sector del cuidado se profesionalice primeramente, ¿no? Es muy importante recordar de que tenemos que saber, ¿no?, o que apostar, el gobierno tiene que apostar porque el cuidado esté en el centro, porque no es solamente una cuestión privada, sino también un bien público. También creemos que se deben crear, ¿no?, políticas para la transformación de lo que es el sector del trabajo del hogar y los cuidados. También crear más canales, ¿no?, de intermediación, tanto para el trabajador y el empleador, ¿no?, donde se doten, ¿no?, de herramientas tales como formación, ¿no?, en temas laborales y salud laboral, perdón, y también, ¿no?, como ya lo había dicho anteriormente, sabemos que el sector está altamente feminizado, ¿no?, y que la mayoría del trabajo del hogar y los cuidados lo realizan personas migrantes, ¿no? Entonces también optamos por pensar, ¿no?, que tiene que haber una flexibilización en los requisitos de la ley de extranjería para que estas personas no puedan mantener lo que es la situación administrativa, ¿no?, regular, y para que también puedan regularizar su situación. Y para culminar, ¿no?, también que las instituciones tales como la Seguridad Social e Inspección de Trabajo creen, ¿no?, planes de actuación para poder salvaguardar, ¿no?, todos los derechos y libertades que tienen las personas, que principalmente, como ya lo decía en el caso que les estaba comentando, el derecho fundamental, ¿no?, que es la vida. También, para dejar una pequeña pixelada, ¿no?, pensar que dentro de nada también tendremos lo que es, o que ya estamos viendo, el trabajo del hogar y los cuidados mediante plataforma, que también es uno de los trabajos que está precarizado ahora mismo, ¿no? Y otra de las mejoras también sería el convenio 190, que habla, ¿no?, sobre el acoso sexual y la violencia que están padeciendo las compañeras del hogar y los cuidados. Esa sería una de las mejoras o una de las recomendaciones que damos como sindicato para poder poner en valor lo que es el trabajo del hogar y los cuidados. Principalmente pensamos que es un bien público y que no es solamente una cuestión privada, porque en algún momento de nuestras vidas vamos a necesitar ser cuidados. Gracias.
Thank you very much. I think you actually put your finger on a very important issue, which is the centrality of the care economy for indeed rebuilding our societies and economies forward better. Its care indeed is a public good, and as such it should be protected better. Very important also what you said about the importance that the ratification of Convention 189 and 190 could play in terms of providing further guidance in terms of how also to extend and adapt the extension of occupational safety and health provisions and social security to migrant care workers, including in private households. So I would really like to thank all the panelists for their very rich intervention. It's clear that fair recruitment for migrant care workers is complex, especially in the current circumstances. But there are quite a number of all the practices, examples that we have been hearing actually point to some very insightful tips for how to move onwards. We would like now want to hear from the audience, and we will place a survey up on the screen to gather your inputs on the situation of the recruitment and working conditions of migrant care workers. We will ask you to indicate if you agree or disagree with 6 statements, which will pop up in a second. And I would like to invite you to take about 1 minute to review them and submit your answers to us. Thank you. Okay, so we have the results of the poll. Sorry, I'm trying. Sorry. I have difficulties in seeing the results of the poll on the screen. I'm sorry, I don't know why. Can you send it again? I can't see it.
Manuela, I can jump in and help. 37% said yes, 63% said no to the question, recruiting care workers is no different from recruiting other type of workers.
And Manuela, you need to be looking at the Zoom screen, not some other tab on your computer. Do you have Zoom open?
Apologies, everyone, for the difficulty. Manuela, the results of the second question, care workers are entitled to the same rights as other workers during recruitment and in their working conditions at destination. 80% say yes, 20% say no. Over to you for the next part of the show. Oh, apologies. Question 3. There's a need for sector-specific recruitment regulation to take into account care workers and their employers' needs and specificities. 91% yes, 9% no. And question 4, during COVID, migrant care workers have been recognized as essential workers and enjoyed equal rights in countries of destination. 33% yes, 67% no. Question 5, current recruitment regulations adequately take into account the needs of countries of origin, including brain drain risk. 15% yes, 85% no. And last question, I believe. Migrant care workers earn on average significantly less than non-migrants for work of equal value. 82% said yes, 18% no.
Yes. Okay, well, thank you for that. I'm really very sorry for I don't know what has happened. But I think it's quite interesting that there is this vast majority on the importance of having some regulation specific to the sector, given indeed the specificities of these sectors. So I think that there is an overwhelming majority, 80%, if I recorded the figure correctly. Also quite interesting is the overwhelming agreement in support of the statement saying that indeed migrant care workers seem to be facing unequal pay. And indeed, this is very, very much consistent with results of a research that we have conducted recently in the ILO with a view to determining whether or not there was a wage gap between migrant workers and national workers, including in the care economy, and indeed the wage gap amounts to 20%. So national care workers tend to earn on average 20% more than migrant care workers. So I think that now we will turn to the questions that have been posed by the audience. And I will try to direct them to those panelists that either have been asked to address those questions, or that because of their interventions may be most apt to respond. During the COVID, one question relates to the fact that during the COVID lockdown, the only exceptions to overseas placement and travel have been the migrant healthcare worker, despite our National Health Ministry serious concerns about the country's need for health workers at this time. This serious dilemma for government policy of both sending and receiving countries, the ethics of recruiting trained workers from countries that are also in critical need for health workers at this time. How have countries managed to deal with these dilemmas? I don't know. Perhaps this could be an answer, a question that could be addressed to the first two speakers.
If I may, I would try to venture an answer. I think the whole picture of demand and supply of healthcare workers during the COVID crisis is a bit of a mixed bag, so to speak. I want to point out that on the one hand, of course, during the COVID crisis, intensive care workers, workers in nursery homes and so on were under massive strain because of the direct impact of the crisis. And of course, there, due to COVID-related dropouts of workers, illnesses on their part themselves, and so on, demand for intensive care workers and workers in care homes was even higher than it was usually before the crisis. On the other hand, we observe reluctance in hiring new care workers in traditional jobs, just like nurses in hospitals, big hospitals with standard assignments, aside from intensive care and, of course, pneumology. Because of their economic situations, due to the pandemic, regular treatments in hospitals were down significantly, very much to the detriment of the economic situation of the hospitals, especially. And this led to a certain reluctancy when it comes to hiring new care workers. As you mentioned, on the side of the countries of origin, of course, due to their impact from the COVID crisis, one can observe a certain reluctance to send care workers abroad. We've observed it in the Philippines, we've observed it in Serbia and in Northern Africa and in other countries of origin. Although, to my knowledge, none of these countries has completely stopped the outflow of care workers. With regard to the WHO list countries, with an official lack of trained personnel in the medicine sector and the care sector, one can say that the new edition of the WHO lists list fewer countries nowadays than before the crisis. So overall, as I said, it's a bit of a mixed bag, but one can see in special sectors and in special country, some countries, that indeed the supply of care workers for cross-border recruitment has been decreasing. So that's for now. Thank you.
Thank you very much. There is another question that I would like to address to Mayank, in which is a question which is contrasting the German models that seeks to partner with local agencies, and Adeco that maintains direct recruitment in origin, in countries of origin. So could we hear more about the advantages of the approach pursued by Adeco?
What happens is that, in a Middle East kind of scenario where the demand of care workers or expat population is so high, and because of that, there is a lot of small-time recruitment firms which try to take advantage of the candidates, because many a time they're unskilled category of the people. So in the country of origin, they can have some practices where they can assure them jobs and charge some money to come get a job abroad in, let's say, in United Arab Emirates and all. So what we do is that's why we do not partner with an external agency. We try to use our own infrastructure, or if there is some countries where Adeco do not have a presence, our team travels there. They create the job drives to book the conference room and all, to ensure that the entire recruitment process is followed as per Adeco's protocol or as per the government protocol. But the landscape is changing in Middle East also. Now government also is putting strict norms when they award a contract to a recruitment agency, that they're going to ensure the parameters of non-discrimination, no financial transaction, and fair wages and all. So that's where we see that organizations like Adeco, who are 100% compliant, are helping the government to ensure that. And just to give you one more statistics, I think from a care worker perspective, there were almost 200 plus small agencies operating in this market who are authorized to apply for care worker visa. They can come and give the visa, and the care workers were working. And government was trying to fix that. There were some practices which were not up to the mark. So what they decided in last quarter is that they have centralized that entire work permit and visa processes through a central authority, which is called Tashil, now, which will ensure that all the compliance is followed and there is no middle recruitment agency or agents which are trying to have some malpractice in this entire process. So yeah, that's how it's very important for us to follow this.
Thank you very much. There is now a question for Fanny, I would say, which relates to the low social value which is attributed to care work. Especially care work which is performed in private households, and this is one of the factors that contributes to the low pay and poor working conditions. What could we do collectively to work to raise the social value attributed to care work? Is there scope to create alliances among beneficiaries, workers, and employers? This is one question which is addressed to Fanny.
Vale, contestando a la pregunta que me estás haciendo, yo creo que la primera cosa que se debe hacer, ¿no?, es que se legitimizar, ¿no?, lo que es el trabajo del hogar y los cuidados dentro de un marco normativo de obligación gubernamental, ¿no?, y sobre todo responsabilidad social. Yo creo que ese sería el primer paso, ¿no?, antes de hacer todas las alianzas, y todo lo que queremos hacer. Lo más importante es que el gobierno tome, ¿no?, o coja la responsabilidad de poner el cuidado como centro, ¿no?, porque es imprescindible, ¿no?, para la salud de las personas también. Entonces, yo pienso y creo que el primer paso que se debe de hacer es legitimar lo que es el trabajo del hogar y los cuidados. Y eso, pues ya sabemos que los que tienen el poder para hacerlo pues son las personas que están dentro del gobierno, y a partir de allí pues ya viene pues todo lo que tiene que ver con la responsabilidad social y la ética moral que tenemos cada uno de nosotros. No sé si respondo a tu pregunta o...
Gracias. I have now another question which actually applies to all the members of the panel. So I would like to know what your views are about this statement whereby the more highly skilled care workers, including nurses, often end up working in lower skilled care positions in the countries of destination. And this may be due to a lack of adequate skills harmonization, skills recognition. So what are, in your view, the tools that can help address this mismatch during the recruitment process? Over to you. Nobody wants to answer?
Perhaps Herbert would like to answer. Otherwise, I would.
It's addressed to all of you. I think this is relevant for all of the speakers, the panelists.
I would like you first.
I just explained the bilateral agreement and the triple win project, and I think this provides any low-skilled workers, because it's based on this high-skilled workers, and the high-skilled workers, they receive all benefits and equal treatment as the comparable national workers. So there is no wage gap, and there is no need to have any low-skilled workers, because the high-skilled are needed in the countries of destination, and we have high-skilled workers from the countries of origin. So
I think that the question was more in the sense that you have highly skilled care workers coming from countries of origin that may be placed in positions which corresponds or are not commensurate with their level of skills. This is the argument. This is the question which is being asked.
Yes,
so
I understand.
That is the case.
I don't think this is possible with the Tribal Wind project.
Okay.
One little intervention to make. I think Habit is right when it comes to the Triple Wind project, because the special situation on the ground, especially in these countries of origin, as Habit explained them. So when it comes to qualifying migrant workers in the care sector in these countries of origin, it is usually a method of upskilling. We have, on the other hand, issues with other countries of origin, for example, Mexico, where the system of professional training often requires a bachelor's degree from a university or specialized care school to obtain this degree, and we don't have a similar system in Germany. So indeed, when a migrant worker comes from Mexico back to Germany, first he and she must take some upskilling and practical courses. That's all good and well, but when it comes to practical work in the care homes or in the hospitals, we often get the feedback from the migrant workers that they're allowed lower skill jobs and not as high level assignments in their daily work as they were used at home. This is because our system is very rigidly divided between medical staff with a full medical university degree and nurses, which is a traditionally middle skill job, which does not require a bachelor's degree of a nursing school. And due to that, the tasks assigned to a nurse in Germany, compared, for example, with Mexico, are indeed, as a general rule, a little bit lower in the qualification demands as they are in Mexico, although other demands, for example, practical skills and so on, are possibly higher. This may lead to frustration on the part of the migrant workers once they start the regular jobs in Germany. So this is something very much depending on the country of origin and the training system there. We do witness in a couple of countries of origin, but as Herbert said, not exactly in the countries of the Triple Wind project.
So you think
just a quick point to add on this is that I think all the inputs are very valuable, but from what we see at a ground level is that it depends on country to country. Now, example, somebody coming from other countries to UAE. UAE has a very strict norms of licenses, which requires, if you are into a nurse category or a healthcare worker or a care worker, there are specific exams and licenses which need to be cleared. But we again attribute this that, there is an orientation program. If the first step of recruitment is right and, there's a fair idea being given that what would be the job. And once they come to the country where they need to work, and we also do the second orientation that what are their rights. If the job promised was something else and what they're doing is something else, they should not ever give their passport or to anybody who is giving a job. And there is a ministry, which is Ministry of Health and Emeritisation, which is MOHRE. An employee can reach out, complain about any gap in the job promised versus what they are doing. And there is a lot of help which comes to them to find upskilling the job which they desire. But yeah, it depends on, let's say, an intensive care nurse in some country may not require some specific graduation certificates. When they come to UAE, they may have to work one level lower till they gain their desired experience to get into that role.
Mm-hmm. So actually, in terms of potential tools for trying to address this situation, I mean, it's could work or collaborate bilaterally with a view to indeed moving towards mechanism for recognizing the skill and for harmonizing, the skills that have been acquired in countries of origin would be one way forward. Just yes or no, please.
Yes.
Yes.
Okay. Okay, very good. Thank you very much. we have really, reached the end of session. There were many more questions that have been raised, which I think it's an indication of the relevance and the richness of your contribution. It's clear that the issues at stake are major. But I also think that there are quite important tips that have emerged from this session today. I mean, issues relating to partnership. It's clear that we really need the government, the private sector, employers and workers organizations, and migrant workers themselves to somehow work very much in tandem. I think that the Germany triple win-win program is quite interesting and telling in that respect. It's equally very important to ensure that everybody acknowledges and recognizes the centrality of care work, paid care work, and the care economy more generally to rebuilding back our economies in the post-pandemic era. There were also plenty of very important issues relating indeed to the need of putting in place some more agile mechanism to acknowledge, to recognize the skills that migrant care workers bring from their countries of origin, with a view also to meeting growing demands in countries of destination, but at the same time ensuring that this does not result into a brain-draining process in countries of origin in which, of course, the care demands are equally important. So a big thank you and round of applause to our panelists, to Stefan Heuke, Herbert Beck, Mayank Patel, and Fanny Galias for your time and for your insights. We encourage participants to keep engaged in these conversations. That are a number of resources that are on this particular subject matter that are available in the resource library, and that you can visit at ILO.org to follow updates on our work in the area of and the care sector. You can also share your reflections on what you have heard today on the social world of the forum platform. Join us for the next session, which will be focusing on strengthening coherence among social sustainability initiatives to promote ethical recruitment, which will start in half an hour. Thank you again, everyone, and have a nice day.